Welcome back. Flagging a decline in COVID tests in many states and union territories, the centre has asked states now to ramp up testing so that the spread of the pandemic can be tracked. In a letter to states and union territories, Union Health Ministry has advised them to increase the testing in a strategic manner, keeping in view the trend of positivity cases in specific areas. My colleague Ayushman is now joining us live. We will also have an expert join us to give us more perspective on this. But first, coming to you, Ayushman, quickly, what exactly has the centre said in its directive to the states with regards to testing?
Well, the positivity rate seems to be concerning, and that is something has been highlighted by the center's letter in two states, in that it has been said that the new testing guidelines should be adhered, but at the same time, the positivity rate should be kept in mind, and all those people who are at risk and those who are symptomatic should be tested on priority. We know that ICMR has released the guidelines in that asymptomatic people's testing has been avoided, and they are not told to be tested unless until the symptoms develop. So that is something which has been again reiterated by the center, but positivity rate should be kept in mind and testing should be done in adherence to that is something that the center's letter to states says.
Yes, right. Ayushman, thanks for joining us. Let me welcome Dr. Rajiv Das Gupta of the National COVID Task Force joining us this evening. Very good evening, Dr. Das Gupta, and welcome to Mirror Now. I want to ask you that why is this step now been taken? Is it because the testing numbers, the figures that we see of positive cases coming down, and there is a sense that the numbers may not be accurate?
Thank you. Yes, there's a concern that numbers may not be entirely accurate. Add to this the fact that in many of the metropolises, in areas or sort of districts within these metropolitan areas, test positivity rate has been upwards of 30% in many cases. Now, on one hand, that's not entirely unexpected, because the South African experience is that through the 4 weeks of December, their weekly average rate was at about 35%. So some areas hitting as high as 50%, therefore on a particular day would roughly translate to that. Mm-hmm. So this is what we can expect, and this is what probably we are witnessing. But add to that the fact that asymptomatic cases, asymptomatic contacts are not being tested, that would also explain some of the decline.
Yes, but as per your assessment, Dr. Rajiv Das Gupta, what is the best parameter at this stage for us to understand the spread of the virus? Is it the positivity rate? Is it the fatalities that we should be looking at? Which are the parameters that you think are the best indicators?
The very specific answer to that is tracking what's happening to hospitalized patients. The rate of hospitalization and the outcomes among hospitalized patients. Now, in general, and I repeat, in general, as we know, Omicron leads to milder disease, but that's also largely in the backdrop of a very high level of vaccination, particularly in the urban areas. Also, among those hospitalized, the duration of stay is also less. But what's really ideal to track in this Omicron-led surge is what's happening to hospitalization and what's happening to those hospitalized. Now, the flip side, the obverse of this is that the earlier panic signals of new cases, of positivity rates, and therefore basing the administrative responses to that are not really that valid anymore.
Yes, which is why there's a renewed focus on testing. Dr. Das Gupta, in your assessment, what stage are we at? Because again, there are multiple different opinions that come in. There are those who believe that things are clearly on a decline, and then there are others who feel that it might be early days to say that. Where do you stand on this?
No, this notion of decline is quite elusive in a country as large and diverse as India. So it will always be a land of multiple epidemics. In other words, different cities, different districts, different states will experience it at slightly different points. But the important thing is that in such a mild disease which is prone to spread under the radar, we need a lot more outreach of testing, of community testing, of promoting home testing, and backing it up with appropriate communication messages. Now, and this is where the home isolation advisory in the UK is very distinct from that in India. In UK, the home isolation is ending after 2 negative home tests at day 6 and day 7, and then the person is going back to work or education and or going out in general. But in India, this is not backed by a negative test. That is a very distinct difference. So in this mild disease scenario, the self tests or the home tests or the lateral flow tests, these have an extremely crucial role to play.
Right. Dr. Dasgupta, this is very important, and you're one of those doctors who have insisted on the importance of home testing, even though we have seen the policies have varied from state to state on this. Thank you so much for joining us, and on the important point of how this is a virus that is now spreading under the radar. So there needs to be a sense of surveillance to track and test, and of course, have more accuracy in the numbers that are coming out. That's extremely important. And we leave it at that for now. Let's move on with other news. Karnataka fights COVID with 41,457 cases at the moment recorded today. Yesterday, the numbers were at 27,156. Positivity rate is up from 12.45% to 22.3%. Whereas the Karnataka government continues to inoculate teenagers in the age group of 15 to 17 years, an NGO in Bengaluru working predominantly in slums of Kormangala and Jayanagar has identified over 800 students in these two areas alone who are yet to be inoculated owing to the fact that they have dropped out of school. Remember, most of the vaccination camps are targeting schools, but some of these teenagers are getting left behind. The NGO claims that it is easier for public health centers to arrange camps in schools and vaccinate teenagers, but then what happens to the school dropouts? Hence, this NGO is now focusing on children in slum areas to ensure that they do not get left out of the vaccination camps.
There are about 850 slum children who are out of school we have already identified. And there are a lot of thousands of children who are going to school. But what we have understood from our discussions with the public, the primary health center, PHCs, is that they are more concentrated to vaccinate the children in the schools. Because they are go to the school and take up the vaccination thing in the school itself. But they are not sure what to do with the children out of school or dropouts. So that's why NGOs are actually very much behind these children and go to every house, enumerate them, bring them and give it to the PHCs. Okay. So what we have already asked and requested the PHCs to vaccinate these children who are out of school. And the PHC has responded, once the schools are completed, then they will take up with the children who are or dropouts or out of school children, and we are just waiting for that.
ನಿಮಗೆ ಏಜ್ ಈಗ ಎಷ್ಟು ಇಯರ್ಸ್ ಕಂಪ್ಲೀಟ್ ಆಯಿತು?
ಇದು ಇವಾಗ 17 ಇಯರ್ಸ್.
ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೋಬೇಕು ಅಂತಿದ್ದೀರಾ? ಯಾಕೆ?
ಇಲ್ಲ, ತಗೋಬೇಕು. ಇವತ್ತು ಕೊರೋನಾ ಎಲ್ಲ ಜಾಸ್ತಿ ಆಗ್ತೈತೆ, ತಿರ್ಗಾ ನ್ಯೂ ವೈರಸ್ ಬರ್ತೈತೆ, ಇವಾಗ ತಗಬೇಕು. ಅದಕ್ಕೆ ಮನೇಲಿ ಇಲ್ಲಾಂದರೆ ಎಲ್ಲರಿಗೂ ಪಾಸ್ ಆಗುತ್ತೆ, ಅದಕ್ಕೆ ಇವಾಗ ತಗಬೇಕು.
ಎಷ್ಟನೇ ಕ್ಲಾಸಲ್ಲಿ ಯಾವ ಏಜಲ್ಲಿ ಸ್ಕೂಲ್ ಬಿಟ್ಟಿದ್ದೀರಾ?
ನಾನು ಇವತ್ತೇ ರೀಸೆಂಟಾಗಿ ಬಿಟ್ಟೇನೆ. ಇವತ್ತೇ ರೀಸೆಂಟಾಗಿ ಬಿಟ್ಟೆ ಸ್ಕೂಲ್.
ಯಾವ ಕ್ಲಾಸ್ವರೆಗೂ?
10th.
ಯಾಕೆ ಬಿಟ್ರಿ?
ಮನೇಲಿ ಸ್ವಲ್ಪ ಮನಿ ಪ್ರಾಬ್ಲಮ್ ಅಂತ ಬಿಟ್ಬಿಟ್ಟೆ. ಫೀಸ್ ಕಟ್ಟಿಲ್ಲ, ಬೇಡ ಅಂದರು. ಒಂದು ಮಂತ್ ಟೈಮ್ ಕೇಳಿದೆ, ಕೊಟ್ಟಿಲ್ಲ, ಅದಕ್ಕೆ ಬಿಟ್ಬಿಟ್ಟೆ.
RDPR survey had done using the PDOs, etc. Now we are trying to such people, and they have to be vaccinated. So using Anganwadi Karyakartas, etc. Anyhow, I am sitting with our Women and Child Welfare Minister Halapacha tomorrow. we'll plan how to vaccinate such students who have been missed in these colleges, etc., etc. And definitely we are going to see that by another 15 days, the whole planning will be done and a vaccination will be done.
My colleague Revati is joining us. Revati, you have given us an understanding of two distinct areas within Bengaluru, but overall in the state, what is it like with children who have dropped out of school and are missing out on vaccination?
Well, across the state, due to COVID mainly and a few other reasons, there are more than 30,000 students who have dropped out of schools, of which 15,000 belong to the age group of 15 to 17. Now, in the larger picture, the total number of students in this age group in the state is more than 30 lakh students. By that figure, if you go by that figure, of course, the number is very small, but there are students, children from across the state who are school dropouts. And what is happening in this case, what is challenging is, while majority of the students, they're identified and vaccinated through these schools, these children are missing out because of that missing link of their educational institution. Now, these are also children who are coming from economically backward sections of the society. They are also getting, like the social workers are pointing out, mixed responses from family or peers. So they are not in a position to probably take a decision as well. So awareness, a lack of awareness is also something that's challenging on the ground. So while there are thousands of students across the state, children who are school dropouts, of course, they can walk into any health center, show their identity card and get vaccinated. But there is also that lack of awareness on how to go about this, how to register for it, the CoWIN portal, all of these factors. So here, in the Bengaluru case, the NGO workers are being that facilitator in this case. And across the state, the education minister has now assured that Anganwadi workers would be roped in to identify these children in every corner. They could be remote areas, villages, etc. All of these places identify these children and vaccinate them. While the numbers, when you compare to the total number, could be very minor, these are children who have been left out of vaccination at this point of time and are finding it difficult or don't know about vaccination or the process of this at this point of time, who are being helped by the social workers, as well as the government now looking to do a survey at a state level and rope in Anganwadi workers to bring all of them into
So this will be a collaborative effort of NGOs, civic bodies and the state and the district administration together will have to work on this. Thanks for joining us, Revati, with your inputs on the story. COVID norms and protocols were openly violated at a college in Kerala's Malappuram, where more than 500 students took part in a party within the campus. Patambi police have registered a case and begun the probe. As per the new rules, only 50 people are allowed to participate in in-house functions and programs.